Greetings. Let us talk about the role of tissue biopsy in gastrointestinal endoscopy. These are my acknowledgements. And today's learning objectives include the following. First, we will learn about the purpose of a biopsy forceps. And number two, how do you handle a biopsy forceps? Of all the devices, if you learn how to handle a biopsy forceps, the rest of the devices will be very easy. So practice how to help with a biopsy forceps and assist with a biopsy forceps. So we do biopsies and get specimens. So before you start your day, make sure you label all the formalin jars so that when you take a biopsy, you're not struggling to find a jar and try to label it in the midst of a procedure. So get into the habit of labeling the jars. Here, the endoscopist found a lesion and he decides to do a biopsy so as to figure out what is happening. So when you think about biopsy, you should go back to your shelf and pick up the biopsy forceps, which comes in an envelope, and take it out, unwind it, and you need to hold the biopsy forceps like the way we have shown on the right side. The right hand holding the handle and the left hand holding the biopsy forceps head in a single U shape without loops. That is very important. Now, let us talk about the biopsy head. Depending upon the size of the head and whether there is a spike or not, and whether it is for cold biopsy or hot biopsy, there are a number of different varieties of biopsy forceps. So let us look at them. This is a biopsy forceps, standard size that goes in with all the endoscopes, and here is the one with a spike, still a standard size. And if the size is bigger, we call that a jumbo biopsy forceps, and jumbo biopsy forceps can also have a spike. All these biopsy forceps are used without current, so they are otherwise known as cold biopsy forceps. So this is a cold biopsy forceps, and compared to this, we also have a hot biopsy forceps where you hook up the biopsy forceps to the electrical circuit and it generates heat, and you can use that heat to cut tissue. So for most diagnostic purposes, we routinely use cold biopsy forceps. So we talked about the head of the forceps. Now we're going to talk about the handle. And handle has a ring, otherwise known as thumb ring. You slide your thumb into that ring as shown here, and your forefinger and middle finger should be on the handle, gripping the handle. If you close your grip, the biopsy forceps remains closed. If you open the grip, the biopsy forceps opens. So close the grip, forceps closes, open the grip, forceps opens. And before you give the biopsy forceps, after checking that the biopsy forceps functions well, you make sure you keep your biopsy forceps closed. That is very important. So when you're handling the biopsy forceps and handing over the biopsy forceps to the endoscopist typically lifts his right hand up and keeps the grip like a pinched grip, and you're supposed to slide the biopsy forceps in between the thumb and the forefinger so that the endoscopist can quickly hold it and then insert it into the biopsy channel. And as he inserts it into the biopsy channel, make sure you use your left hand to create a nice upward loop so that the endoscopist doesn't have to struggle and he can slide the biopsy forceps nice and easy and with nice clean strokes. So let us look at how does it look when the biopsy forceps comes out into the field. You keep your right hand grip closed so that when the biopsy forceps comes out, it remains closed. You should never open your right hand grip when the forceps is going in and out of the channel. It can destroy the channel. So keep your right hand grip closed, and when the biopsy forceps comes out, it remains in a closed position. When the endoscopist is ready and says open, you open your right hand grip and the biopsy forceps opens, and he gently pushes to the site where he wants to take the specimen, and then he will ask close, and then you close it and keep it closed so that you grasp the lesion and the biopsy forceps is gently pulled by the endoscopist so as to avulse the tissue and take the specimen. So let us take a few minutes to look at it by looking at what happens at your hand and what happens in the endoscopy field. So here, your right hand on the handle is closed, closed grip. The biopsy forceps is closed, and when you open the right handle, the biopsy forceps opens, and when you close again, it closes, and then once he grasps the tissue, the endoscopist avulses it, and then you pull the biopsy forceps out or help the endoscopist as he pulls it out in nice clean loops with a gauze so as to avoid spilling from the biopsy cap. So make sure you keep nice clean loops as the biopsy forceps comes out. It's very important to practice how to give a biopsy forceps as the endoscopist inserts it into the endoscopy channel by creating a nice upward loop to make it easy for him to push it down. And when you pull the biopsy forceps out, make sure you put gauze at the biopsy port so as to avoid spills, and then create nice clean loops as you bring out the specimen. Once you bring out the specimen, make sure you look at the specimen and see whether you have a good specimen, and then drop it into the formalin jar. As you drop it into the formalin jar, you should say two things. Where did the specimen go? Did it go into jar A, jar B, or jar C? So you say specimen in jar A. And then you also say whether the specimen is a good size or a small size. So typically I would say specimen gone into jar A, good specimen, or specimen gone into jar B, specimen is small, so that the endoscopist knows whether he needs to take additional biopsies. After you have communicated well and clearly and loudly so that the endoscopist hears and the nurse who's at the other end of the room may also hear. Following that, as you dip the biopsy forceps into the formalin gets onto the forceps, so you want to clean out the formalin by dipping in a basin of water. Dry the forceps, and repeat the biopsy again if the endoscopist wants to go ahead and take some more biopsies. At the end, make sure the jars have been properly labeled and every specimen went into the proper jar, and you finish your procedure with the biopsies. For the most part, endoscopy biopsies are safe with the exception of some bleeding in patients who have blood disorders, especially if they have a very thin blood. I must say that if you practice how to assist with a biopsy and you perfect that technique of handling the biopsy forceps as it goes in, comes out, taking it, putting in the jar, and you perfect that technique technically, everything else in endoscopy that is related to handling a device with a thumb grip, as you've seen in the biopsy forceps, will be very, very easy. Thank you.